go.
Have you been adjusted like that before?
I have.
Okay.
Not quite that much.
Not that much? Okay, all right. Nobody does it better. Probably haven't noticed this guy before, huh?
Oh.
Yeah.
You're way stronger in person than on YouTube.
Okay. Well, if I'm going too hard, please let me know, okay?
Yeah, you're good.
Okay, all right. I'm a very greedy chiropractor. All right.
I'll take it.
That's so funny.
The elbow looked so much nicer until he. Oh my gosh.
It's easy watching other people.
Cool. Yeah.
And that's a huge difference.
Oh.
There you go. There you go.
Wow.
I might be the smartest doctor. Whiplash, then neck hurts. How did you figure it out, Ed? Mm-hmm.
Wow, how'd you
questions?
Right? How'd you put that together?
Oh. Okay.
She can't really stand it.
All right. Okay. All right.
I rotated my T3
Okay.
upper,
Okay.
motorbike accident, but
How old were you when that happened?
that was 7 years ago.
Okay.
8, 7, yeah.
So just on a regular street, just crashed, or can you go a little more over that, or just?
It was a scooter in Thailand, going down the hill. Guy was following, ended up stopping. I thought he was going through the light, and then pulled the brake and went over.
Okay, I got you. All right, and so. What did you contact when you landed from that? What do you think first hit? Your wrist down
I think
or
my
shoulder?
shoulder.
Gotcha.
Yeah.
And is there any symptoms in your neck or shoulder right now, or how are you feeling since that happened? Just kind of resolved and.
Yeah. Most of what I would complain about is just overall tightness, stiffness.
Okay.
And then I know my neck is forward, and then my jaw gets a lot of tightness.
Okay.
And clicks.
So when you were going to a chiropractor, what was their goal? They weren't really looking at your posture. They were looking at curves. Or were they doing that, or?
So the one gentleman, he was an Atlas orthogonal. So
Okay.
he was working mainly with the Atlas and then using a percussor
Okay.
to put certain things back in place.
Okay. All right. I got the idea.
But-
So chiropractic started off, I call it zoomed in.
Mhm.
And my dad's a chiropractor, and he taught me Atlas when I was a kid, and Atlas is a perfectly fine technique, but it's a very zoomed in technique when you're taking T3s rotated, so you can look at the spine. And I grew up as a kid. They had a thing called a spinal thermogram. Maybe you've seen that. You run it up and down the spine. It's
yeah.
a temperature. So if you're wondering, when I was a kid, I watched my dad. He'd run this probe down each side of the spine, and it's checking for temperature differences between the left and right.
Okay.
And the idea is that obviously if one side's inflamed, that needle will move to the side that's inflamed.
Okay.
Now, the difficulty is what happens if both sides are equally inflamed. The needle will move and you miss it. So there's some drawbacks to it, right? If you sprain both sides, then it's only checking for differences in temperature. Now, generally, the needle will move on the areas of injury. Usually that's where there's something injured, T3, that's what got injured when let's say you fell, or maybe even as a compensation of when you fell. But it's very kind of zoomed in on the symptom. Does that make sense?
Mm-hmm.
And philosophically, I have some issues in terms of if the area is injured, maybe it's injured because it's moving too much, right? It's injured because it's being sprained.
Okay.
And that's why the needle's moving, because one side of your neck is sprained. You fall on your left side, you injure the left side of your neck, and so your head tilts to the right, and now you're inflaming this because your head tilted after an injury. And it's a common thing will happen. Your body will seek what we call antalgia. So the front part of your spine has very little feeling. The back side has a lot of feeling. And so as a result, when you're young enough, that when you have a fall like that, well, Ed, I felt fine, Ed. My body just changed its position, which it's like the alignment of your tires in your car. Now your tires don't last as long. And this is what you're asking me for, preventative and maintenance. The idea is, well, let's look at you from a perspective of, are you in the right alignment for longevity, right? Is there a curve in your neck? So this is where I have to zoom out, right? Because if you're zoomed in, I can't see if there's a curve in the neck when I'm so zoomed in on the spine. You have to back up a few steps and go, okay, his neck doesn't have a curve. And so other things we know about the curves in the spine is that when you lose the neck curve, it can go into a laterality somewhere else. And so sometimes there are rotations or tilts or scoliosis can form as a result of losing the what we call cervical lordosis.
Mhm.
So there's a natural curve that you develop when you're about 3 to 6 months old, and this is supposed to take you through life. You're supposed to have this curve and allows the weight to be evenly distributed, meaning that not any one area that probe would detect be overstressed if there's a curve in your spine. The same thing in your lower back. So we call this global postural analysis versus
Okay.
atlas and orthogonal, which does a more segmental approach. The position of this vertebrae next to that vertebrae, the position of this vertebrae, they're looking segmentally. I look globally, which is, do you have a curve in your neck? Is your ear over your shoulders? Are your hips level? Global postural analysis, atlas orthogonal and Gonstead, those are more like, they were started in like the 50s. There's a little bit, they've been around a lot longer. My dad was taught that, when he was in school, and I had as an elective. The iPhone update came out, and I call it, that we can't change posture through adjustment. That's the first fallacy that my dad, the main thing that helps with the atlas is that the table you lay on actually changes your posture. When you're laying face down on
Okay.
that atlas table,
Yeah.
that table actually holds you in the mirror image, and that's good. They actually do the clicker while the magic is the table. My dad would say he's kind of like the secret of atlas. Like that table is the amazing thing because it actually holds your head in the mirror image, and then you stimulate all the proprioceptors with the activator. That's what you're doing, and you're trying to reset someone's posture through your cerebellum. I don't like too much information, but it does work. It's just a little bit more segmental than I like. I sort of zoom out and I want to influence the ligaments that wrap your spine, and that's what I look at a picture for. I would look at your X-rays, your MRI, and instead of looking at each segment, I'm going to look, this whole curve here is not where it should be. Let's work on getting your neck curve back. And so somebody online will go, Ed, you diagnose all these different types of problems, but you treat them the same, because I don't treat symptoms, guys. I treat posture, right? Is your spine in this alignment? Do you understand? Do you have a curve in your neck? Do you have a curve in your back? Or is your head forward and you've lost the curve in your neck, right? And then because we're not in the right posture, now you have pressure points, now you have pain, now you're gonna have things that are gonna cause that needle move because you're not where you're supposed to be. Your head's tilt, it's really a right neck.
Okay.
Your head's tilted left, and then you're doing this essentially. I'm
Okay.
exaggerating, but that's the
Yeah.
that's the misalignment. Chiropractic biophysics, they do them as 3 different grades. The first misalignment is a head tilt. Second is they'll call the writing reflex. Your eyes will level, and then if you can keep this long enough, eventually your shoulders will level, but then your head will just be translated. So we call that translation is when it's been there long enough. So you actually are in what we call phase 2, which is the head tilt, and now you have the shoulder tilt, but it's really a head. We're going to find on the right side of your neck in a second. You have an injury over here that's made your head avoid it, and then hence why it's not bothering me. Well, that's because you're in avoidance, and you're young enough that you can continue avoiding it until you're 35 or 40, and then the problem can grow large enough that you no longer can avoid it, and now that's when everybody all of a sudden starts to agree with me and say, oh yeah, there was a problem over there. No, there was a problem back when he was 27, and he was in avoidance, and we should have confronted it then. We got to get that suppleness back to your middle back here, because the head's forward, head's about 1.5 to 2 inches forward. When your head goes forward, your middle back
Okay.
gets tight, right? So your ear, external auditory meatus, should be over the center of your shoulder from the side. And when the head goes forward, there's going to be perpetual stiffness and tension, and even rotations of T3. Do you understand? Because the head's forward.
Okay.
And so ultimately, we've got to the care has to be focused on lining up, called the EAM, center of the acromion, side of the hip, side of the knee, and the lateral malleoli. That lateral malleolus, lateral part of your ankle, that should line up with your ear hole. Do you understand?
Okay.
So if you do what we call a plumb line, so if you look straight from the side, here's where your malleolus is, right down here. That should line up. That does line up with your acromion. Do you understand? So you're not angled forward so much with your chest, but your head's just forward. Even jaw pain happens because of the head being forward. So as the head goes forward, the jaw starts to go forward. That starts inflaming the TMJ. And so forward head posture and jaw pain are connected. And so you can rub the jaw and do activator on the jaw, but ultimately if we don't get the ear back and the head back, and so we'll show you some things called denerals, which are the ways we stretch the spine. It's stretching that took 1997, chiropractors figured out that you have to stretch the spine to change its position. So adjustments, as much as I wish it were true, can't move your head back over your shoulder. I can't just, the ligaments that wrap the spine have to be influenced. Bend both the knees. Yep, feet flat. Cross the arms for me. You're doing great. Take one deep breath in and help me sit up. Help sit up for me. Deep breath in. Deep breath in. Exhale. All right, deep breath in. One more. Let it go. All right, good. Stay to breathe. Yeah. All right.
Mm-hmm.
So some bones moved. I had to put a lot of pressure on them, but with your age and with your work, I'm impressed that there was any movement. Because generally when you're holding something or lifting something, you want to lock your chest, right? So carrying something, you don't carry something like this.
Sure.
You lock your chest, right, and you carry it, right? So your job encourages chest stiffness. You're saying you're a better mover with a locked chest. It's not great for longevity. That's the problem. In order for your spine to last as long as possible, we need to encourage your middle back to be loose. And so the idea would be that you keep doing your work, you gotta get paid. But at the end of the day, we do things to keep it limber for longevity. And then hands on your belly. There we go. Look over this shoulder. Just turn your head and put that little back of your head. There, perfect, just like that. Deep breath in for me. And then exhale, twist. Good. Other side for me. Good. I gotcha. And exhale. Exhale. Good. Face up for me. Come upwards a little bit. There we go. Okay. We're moving there. All right. Let's see. Where is this? Yeah. Right. Yeah. It's right here. It's a little lower. It's not the atlas so much. It's kind of the middle neck right there. C4, C5 on the right.
Huh.
The atlas is not. Maybe minimally. Got a very small atlas misalignment. A little bit to the right.
You can tell that just by feeling it?
Yeah, the wings. You can feel the wings. So you can feel the. In school, when you're learning it, they feel like little. They're really long.
Oh, okay.
I mean, really long. Look at the wings of these guys, right?
Uh-huh.
I mean, they're like freaking. They're sticking out there. So that's what I'm feeling. I got my hand. I got my fin, and they should feel like a little pencil eraser underneath the skin. Is what they teach us. So now, if the bone is over to the side, then I won't feel one side, and I'll feel the other side sticking out like a Frankenstein bolt. So I got your head level with your shoulders, and I'm feeling for the atlas. And there's your atlas, right? That little, right there. That's your atlas right there on the right. And I got a pretty good palpation of your atlas. Now, if I tilt you, watch. If I tilt you, now it's sticking out over here.
Right.
Right. But you have to be level, and then we feel the atlas, and I have it pretty level. But now I go down to this lower vertebrae. So here's C2. This is your second cervical vertebrae. He's over to the right. And then the whole thing's blown out to the right. This is all sunken in over here, and then you got a massive blowout down. Look up, feel that giant knot here, and I got like nothing here on the left. So you're in right avoidance, but it's kind of the middle lower neck that's doing it. I would argue that this happens because this is probably stiff up here. So the upper neck is stiff, the lower neck got overstressed. Now the lower neck is tilting because the lower neck shouldn't be doing a lot of the work to begin with. And so as a result of the lower neck being overburdened, now your body's trying to, and maybe an injury or maybe even that fall, which you said was left shoulder, fell on this side.
Yeah, left.
So, you get jammed, maybe that tore the right side of your neck out. That makes sense. So the force went into your left shoulder. Your head would have the main force would have been the left head tilt. Do you understand? When you collide on the left side,
Right.
so you would rip the rubber bands on the right side of your neck. And so this doesn't have the power to pull this back straight because these ligaments have been torn. Could be. I don't know. It could be many things, but I'm saying that's a possibility. This is definitely all pressed out here on the right side. When you fell, this upper neck should have absorbed most of the force. The lower neck shouldn't have been the one that was in the front line to begin with. So the lower neck will get happier when it sees that the areas around it start doing more work and the burden being off of it. It'll move also at the same time, but I don't want the primary amount of force, there you go, to be in the lower neck. That feel you okay?
Yeah,
Yeah,
good.
Relax here. Chin up for me a little bit. Very nice. Okay. Have you been adjusted like that before?
I have.
Okay.
Not quite that much.
Not that much? Okay, all right. Nobody does it better. That was a test. I'll show you the left side in a second, but
Okay.
that is an injury.
So it gets pulled and forms into a knot?
Right, your body expects it to happen again. So whatever stress happened in here, part of it is the muscles are protecting it. You have guarding, right? Your body expects you to fall off another scooter or whatever, motorcycle, whatever. Your body expects it to happen again, and so it puts up a wall in anticipation of a future. And so for the longevity of your spine, we can't let it stay there. It has to be, the dent has to be pulled. There's a dent here kind of idea. I got your head, there you go. And then it makes your neck more prone to be comfortable with your head forward with the loss of the curve. See, this position, your neck belongs way back here,
Oh, wow.
right?
Yeah, no.
Your neck belongs here. This is where, again, your jaw would be happier.
Right.
Your head's forward. I looked at you from the side, your head's an inch and a half, 2 inches forward. That's your problem. Head weighs about 10 pounds, 10, 20, 40. It doubles every inch. So your muscles in your neck feel like they're holding a 40-pound head. Their spec rating was to hold a 10-pound head. So they're going to age at 4 times the rate because they're doing 4 times the work. And it's going away actually pretty good. It's nice being 27. 26 is when everything starts to harden. So you're right at the cusp of where changing the posture becomes more difficult. So
I'm going to ignore that.
What is it?
I'll ignore that.
So what I'm saying is easy to change this at your age.
Okay.
And so you can make it actually change dramatically. This knot has gone in just by holding you to the right for a little bit. Man, it's pretty remarkable actually. It's almost getting this pretty. So the idea would then to hold that with this piece of foam called a Denerol. It would actually emulate my thumbs and hold you in this position.
Okay.
And that's how you accomplish it. 20 minutes for 20 times stretching, and we'll show you that at the end. It feels great. Wow, that's nice. Yeah, it's like, see how it's just smooth the whole way?
Yep. Yeah, that's...
I mean, it's blatantly obvious. There's no bump over here. That's what I was feeling when I had your head straight. And Ed, I feel like you rub the right side of my neck a lot longer than the left side. That's correct. I'm not going to rub the side very long. There's nothing here. My dad taught me you don't arbitrarily rub something. The right side, right there. When there's dead blood, congestion, lactic acid, inflammation trapped in these areas, combing the tissue is going to draw it out. The mark is never normal. The mark is a result of what's been encapsulated in the tissue. You understand? So my point is that as my patients progress through this type of care, no marks come out. You understand?
Okay.
It's not breaking blood vessels, because if it was just breaking blood vessels, I should be able to break them wherever I want to break them, whenever I want to break them. Does that make sense? But the mark only comes out in certain areas, and generally, it's like running a vacuum cleaner. The first pass you make, you get the most out, right? And every subsequent pass, you get less and less dirt out of the carpet as the spine becomes cleaner. And then also you teach the patient to take their shoes off the front door, and they stop tracking in so much mud, and then the carpet stays cleaner. Does that make sense?
Right.
A lot of these areas that are tight, because of the posture, because your head's forward, these areas are really tight, right? And that tightness in the muscles restricts blood flow.
Okay.
Right? So think of the blood vessels that are trying to perfuse this tissue. The tight muscles from your work, from your posture, limit circulation, which then allows the dead blood and lactic acid to build up from that stiffness. And it'll directly correlate with where you feel symptoms. You go, Ed, there's something right there. That makes sense. I'm sure you feel there's some soreness in there. It directly correlates with what you feel. When the upper neck's not doing what it's supposed to do, your lower neck will be overstressed, and then you actually recruit your upper back to do work that this was supposed to be doing. So you actually torment your upper thoracic vertebrae because the upper neck is stiff, because this is tilted. And that's probably as most obvious as it'll get in my office. It has to do with the head tilt. So if everybody at home can see, because his head's tilted left, his left shoulder's elevated. Because his left shoulder's elevated, this is all expanded open. This is not its own monster. This is a result of this, is what I'm trying to say. You're saying this is a mirror, this is a reflection of this. Okay? It's not its own problem. This is a compensation of a neck misalignment, but this is a larger one. If I put a marble on your back, it's going to roll off to your right. Do you understand?
Yeah.
This is low. You'll feel it. This is low over here, and it is massively popped up right here.
Oh, wow.
Nobody said anything like this. Nobody. I mean, this is not a small one. This is eventually going to cause right sciatica. So because this is stiff,
Okay.
the right lower part of your back will be the first part that wears out. Again, you're here, and hopefully we'll never get there. And you're saying, I'm just telling you what. If you don't have a person like me or me in your life, Ed, my right leg, you're right, Ed, you predicted the future. My right leg was starting to have sciatica right at 40. You understand? Because we left this here for too long. This is going to throw the work down to here because you're in left chest avoidance. You're in right lower compensatory abuse. You told me preventative. I looked at your paperwork. So I'm giving you.
Appreciate it.
My wife's always like, what do you work on? I'm like, I will address every single thing that person puts in major complaint. The fix is to mobilize and restore the alignment of your spine, specifically right here. This won't go away if we don't fix this. This will keep getting fed, kind of a domino effect, because the head is tilted. But that doesn't mean that we can't work on this. BJ Palmer would have spent his entire visit in your upper neck. I don't agree with that. I do understand what he was getting at, which is that if you don't fix the neck misalignment, that you can't ultimately fix this either. But that doesn't mean that we can't speed this process up by working on both and working on everything. There we go. Anyway.
Prevention and random facts.
Yes,
about
I know. Well, if you go in my office, I have a picture of BJ Palmer on the wall, and it's like, why does he have his photo on your wall? Because he is the reason why we're here today. If it wasn't for BJ Palmer, there wouldn't be chiropractic as we know it. His father, started it, but he was the one who basically opened up the schools and, wanted to get it into the masses and teach people how to do this and help people. Probably haven't noticed this guy before, huh?
No.
Yeah.
You're way stronger in person
Oh,
than on YouTube.
okay. Well, if I'm going too hard, please let me know, okay?
Yeah, you're good.
Okay, all right. I'm a very greedy chiropractor. All right.
I'll take it.
That's so funny.
The elbow looked so much nicer until he. Oh my gosh!
It's easy watching other people.
This is for everybody at home going. That looks nice. I don't know. No.
That's my favorite comment of the day.
No. Well, like I said, we don't need. I'm not here to overwhelm people, but I am here to confront. I'm here to show you this needs to be confronted.
Mm-hmm.
It will not go away gently. It has to be grabbed and like thrown out of the bar, kind of idea. All right. Take a break.
What is that?
That's my dad. That's my dad over there.
No. What you were just touching?
Oh, this.
Oh,
Sorry.
sorry.
These are the roots of your neck. These are the roots of your neck here. I wonder if we could hear my father. That was my father. So these are the roots of your neck. These are the thoracic outlet, first ribs here. Trying to bring these ribs down. They elevate at the same time your head goes forward. So we call this coupled motion. When the head goes forward, the ribs in your upper back elevate. In order to bring the head back, these do need to go down. They both work together in concert. These have to go down, the head has to come back. Right there, yep. Okay. There we go. Okay. So you have 4 large muscles that attach in here. Your diaphragm, your trap, your lats, and quadratus lumborum. It's like a Times Square intersection. And so this area, especially when you're carrying or lifting, this area locks, right? This is where, when you're lifting, you should try to exhale,
Okay.
right? You don't want to be, the fastest way to injure yourself long term is to hold your breath while you're lifting and hold. It's why you try to exhale when you're lifting. These are good habits to install. What exhaling does is it forces a diaphragmatic relaxation, right? You're relaxing your diaphragm when you're exhaling. So this area that's used to fortify, to stiffen your chest, is also forced to be a little bit more limber when you're exhaling. The stiffer this becomes, do you see how this overstresses?
Mm-hmm.
Right, because this gets all jammed up here. Yeah, right there. When you're sitting in your desk or on the airplane, we're gonna actually put something behind your back right here. It's where you should take a rolled up towel or a pillow, kind of middle back.
And put it lengthwise or tallwise?
Well, kind of be, I guess, not lengthwise, transverse or perpendicular to your spine,
Okay.
right in here. We're trying to prevent this from slouching out, from rounding out.
So just on the left side.
Well, both sides would be fine, but yes, I mean, if you could wedge it more on the left, that'd be better, yes. But it doesn't need to be, I'm not looking to go intense, or, if you move to Sarasota for a month, then we can get intense, but for a preview, the idea would be that, yes, to move up to something more intense, but we want to first get you limber, get the spine clean. So the kind of the beginning tools that I can show you are, just starting to put some pressure here when you're sitting, when you're, like I said, airplane, or when you're at home, whenever watching TV. You don't want to be sitting just rounded out here. First way to fix a problem is to identify it. No one even identified it, so that's the problem right there. And it's like this whole section. It's like T8 through T12. You understand? The whole section here
Right.
it's not just one vertebrae. As I said, I'm zooming out. This in and of itself wouldn't be the symptomatic area, like I was saying earlier. The right lower back would be the compensatory. This would just lock. It'll be most uncomfortable when you're worked on because it's the stiffest part, but most people wouldn't notice this until it's elbowed, until it's adjusted. We don't feel the tight parts of our back, the parts that don't work. We only feel the areas that are compensating.
How long do you think it would take for that to be an issue?
For the lower back on the right, that would
Yeah.
be another 10 years.
Okay.
Yeah, it would be a while. You'd probably have to minimum another 5 years, but probably by late 30s, this would become a problem. We could, an MRI would give some information on that, but our world really doesn't do healthcare on this. They wait till the disc gets injured and then we respond. The healthcare would be, let's not let the disc get injured to begin with. This area being stiff up here is going to start overstressing the disc on that right lower part of your back. Getting your lumbar curvature back to your spine, keeping your middle back lumbar is going to prevent all of this from even happening. This side is not nearly, just like the left side of your neck is not nearly as elevated as the right. I mean, there's some, but it's not nearly as big. One side's getting an F, the other side's getting like a C+. You understand? C+ is pretty good at. Okay, well, whatever, but it's not an A, but it's not an F. It's a pass rating. I give the right a pass rating here. I try to help people understand. I mean, I had a chiropractor as a father. Right? I was worked on all the time, and my dad had that spinal thermogram. As a kid, I used to watch hundreds of people getting that done.
Yeah. It's all my shoulder right there?
Yes, sir. Yeah, subscapularis and ribs in here, rhomboids. So very quickly, That's, you can see it right there. That's where the epicenter is. Like I can comb everywhere, and not nearly certain areas to come out with a darker mark. Where internally there's blockages. Where I'm almost going to draw an outline of it. Mhm. You do a shoulder workout every day, and I feel it all in here. Gee whiz. I got you. Oh, I didn't know that was over there, Ed. I know.
What is that?
This is your rotator cuff.
Okay.
This is what this is your moneymaker, I imagine. This is what allows you to work so hard, but there's a lot of tension in here I was feeling. So I wanted to shine a spotlight on it for a minute.
Yeah, never felt that.
Yeah. You gotta clean this out. Your lats a little bit too, but mainly rotator cuff and lats.
Did not know all that was supposed to move.
Yeah, this is ancillary buildup that your job has created. This is not. I don't particularly think this needs to be worked on all the time, but I'm just since I feel it, I'm going to clean it up anyway. Getting your posture fix is primary, but
Right.
that doesn't mean we can't help to clean up some of the other messes in here. But being a mover, my gosh, your chest just needs as much limbering as possible. Like I said earlier, because your work encourages heavily stiffening this area, and so as much as you can get, you're going to get some benefit. I mean, of course, just the deeper that you can get, the better, and the more that you can handle, the better in terms of the depth. All of this should be easy. There is no normal soreness. There is no normal pain. You know, when I rub your back, it's not like, oh yeah, that's just the normal part that hurts. Like, no, sorry. You should feel pressure, and that's it.
Yeah, I didn't know all this hurt.
Right. I know. All right. We gotta work through that. Right there. Yeah, if I didn't know better, that shoulder hit, you understand? You hit this whole section, you understand?
Yeah.
Got collided with, your chest leaned to the left, sorry, to the right, and then your head tilted left. That would be my opinion of that whole, that accident. And then you healed crooked. And then because you healed crooked in avoidance, there was no pain.
Right.
Until such point in the future where now the alignment causes a compensatory pain from the frame not being on straight. But this all got to me, like I said, you got hit and then you tilt to the right. I know this is what hit. Does that make sense? But this, they both took it. There's way more here on their left. I mean, that's a significant amount of injury, congestion. Your body expected you to fall again. Do you understand? When you fell, as a result of it, your body's like, "Oh, is this a new normal? You gonna do this again?"
Right.
And so it put up walls and tightness in anticipation of it happening again. And even though you're like, "No, body, I'm not gonna do that again," your body doesn't believe you.
Yeah, no.
It's like, I don't trust him.
That was the last time I rode a two-home.
No. But yeah, right there. I mean, I can't make a mark here if I wanted to. Like, it's just here. Like, I'm combing everywhere. That's what's so cool about this tool. I can comb everywhere, but like no mark here. But there's a huge mark right here. So it happens because that's what was damaged, and then the body tightens it up, it hardens the tissue, blocks the circulation. The more forward your shoulder goes, the easier it is to injure your rotator cuff. So at the end of our visit, when we're stretching, I'm going to show you some things to actually draw your shoulder back, making it harder for you to injure your rotator cuff. So you see how the more forward your shoulder goes, all these muscles are held taut like ropes? So think of a cable or a rope that's held tight or taut. It's easy to cut it, right? But if the rope is held loose, it's harder to cut the rope. You understand?
Okay.
So the tendons and cables back here are held tight when your shoulders round forward, which again, your work requires, making it so at some future date, you tear your rotator cuff. Do you understand? These are common injuries that happen to the shoulder because of alignment. You were set up for it. Nobody wanted to try to teach you how to get your shoulder back to make it harder to injure your rotator cuff. And again, he put prevention on his chief complaint. So I'm going to give you all the preventative. Today's visit's about how do I not let anything happen to me? Well, let's get your shoulder in the right alignment. Let's get your back in the right alignment. And then, not to say you're immune. I didn't say. I said it harder. You understand? It's going to be harder for you to get injured. More stress, more severity to reach that point. But yeah, anybody can fall off something. Anybody can get injured. But let's try to get it on the path of highest longevity. So the more inflammation that's on the back part of the shoulder also, it's going to make your shoulder desire to go forward, right? So that makes sense. The more bruised this is, the more your body antalgically wants to rotate your shoulder forward to get away from it. And a mark's coming out. The mark's like the cheating way to know when there's an injury inside, because it only happens where there's something that's been internally damaged. And this is where the collision is also. So, and you already told me I fell on my left shoulder. So I expect to find some induration in here. There's someone out there that sounds like me. Who could it be? Maybe Dr. Bell. My poor patients that are in my normal practice are always like, "What, did you clone yourself?" There's like two of the same voice in this office.
I think you sound different.
Okay, thank you.
Oh, no kidding.
Right, it's that left. That's the
Yeah.
something happened over here. But there's one there, and then on the back side, yeah, right there.
Oh,
So
wow.
you can see there's some over here, but right there.
Yeah.
That's where that epicenter is. I mean, T3, I don't know, whatever. That's a result of the other guys, in my opinion. All these other tilts and shifts are now, making that guy move. But I got you. Oh, yes. Dr. Ed, you're amazing. It's okay. Good, I got you. left side. It will auto level as we stretch. Do you see how when we're going to be on our stretching in a second, you're going to feel crooked on it, but it's not that you're crooked on it, it's because your back's not level.
Right.
So you're going to feel like you're not on it straight when you are on it straight, but because your back isn't level, you're going to feel lopsided. And then as you progress through it,
Right.
you won't feel lopsided. And then, yay! But I'm just giving you a preview where we're heading in a second. You're going to feel like, and I feel like it's pushing more on my left side of my back. Correct. This side is more like this is even pressure, but the left side is so much more elevated that it'll feel like there's more pressure on the left. Yeah, having a chiropractor as a father and analyzing postures as I was a teenager. Yeah, that's all I. Yeah, my dad and I would be out at the mall just looking at people's posture. I mean. Nice. Ooh, that felt good on my end. At church, everywhere, people always like, stop looking at my posture. I'm like, I'm not looking at it. Can't turn it off. Nice.
That's crazy. Yeah, I've never been able to do that.
Yeah. Oh no. Yeah. Cool. Yeah.
I mean, that's a huge difference.
Cool.
Yeah. These were all stuck. You got to get, and then the idea now is to actually hold you here.
Right.
And then the next time you go, and then you go, and then you.
Yeah,
I know. It's very nice. You don't have a rod in your back. I don't have a rod in my back.
Yeah.
The potential shouldn't be any different. You have the same vertebrae, the same vertebrae in your back that I do. It's the fact that if you don't use it, you lose it, and you're a lot stronger than I am. I'm sure holding an object for all day, I'm going to fatigue out and you're more powerful. So with power comes to stiffness. You have to tighten your back to be powerful. So there's a balance of that I'm trying to teach. You need flexibility for longevity. You need power for your job. 1 second, keep your head straight. Okay, now tilt right for me, tilt right. Okay, so sometimes you don't get them. Tilt to the right for me a little bit, tilt right. Okay. Okay. Go ahead and tilt to the left for me. There we go, a little bit. Go ahead and tilt to the left. Okay. Do everything. Good. Put the hand in the hip for me. Go. Press back with your elbow into my elbow. I think it moved. Perfect. It's good. It's good. No, don't ever like this. Always just straight pull. If you ever have to release, just straight traction. You're not going to hurt anything. Just tractioning, opening the joint, getting blood flow in here. There we go. Good. No restrictions. I'm feeling for there's 2 rows of 4 bones, and so I'm looking to make sure all the bones are moving in here. Sometimes you'll have injuries. I'll go to bend the wrist, and it's like I hit a wall. I don't on your wrist. That's what I'm feeling for. What are you feeling for? I'm feeling for suppleness inside the wrist. Same thing, elbow. I'm looking. There we go, a little bit there. And put this on your hand. And press back. There we go. Yep, good. All right, come on over here. I'm going to show you this. This device is designed to be rigid, and your neck is designed to bend around it. Lift that for me. And lay your head back. There we go. And then what you'll do is you'll take your hand, place it on your forehead flat, and then you press. That makes sense? But you got to get your head to sink in. And then because that right side of your neck is a little bit more popped out, you can do a little bit of right rotation also.
Okay.
So to get a little bit more pressure on that right side. That makes sense? These are powerful devices in changing your posture. The goal is 20 minutes. 20 minutes is not a made-up number that I thought sounded cool. 20 minutes is a real number for stretching the ligaments that wrap the spine. They fatigue, or what we call ligamentous creep. At about 20 minutes, they actually start to lengthen, and that's where posture change starts to happen. So the goal is to hang out here 20 minutes, put a TV show on, lay on the floor, and it's just really about trying to let your body sink into the floor, letting your neck relax, letting the tension in your jaw, face, everything, all that's happening because your head's forward. You are ready to use the roller. Go ahead and sit up for me. Lay back for me. I got you. Okay, good. Lay back. There we go. Head back for me. There we go. You're going to want some books behind your head. Bend the knees for me. What the books do is they prevent you from bending too much in your neck. So your lower neck relatively, your lower back and lower neck relative to your middle back and upper neck are very loose. So if I bend you back, the loose parts of your spine are going to want to bend the most. And that scares me because I don't want to injure the ones that are already moving too much. So to prevent that, we use some books behind your head to make it bend just where it's pressing on your back, not in an area that we don't want to bend.
Okay.
As your middle back starts to bend more, we can take these out. Eventually, these don't need to be here at all. The goal is time. Time is more important than depth. First, get to 20 minutes, then we can start reducing the depth. If you're not worked on at a deep level, that's why I have an office. Otherwise, I would just sell stretching because you can't take a layperson and put them on this. They have to be beat up. All that inflammation in your back has to be cleaned out.
Yeah.
And then pretty quickly, like just if you were here in Sarasota, by visit 5, 6, 7, all that bruising would stop happening. You understand? I wouldn't be able to make a mark on your back anymore. And also, you'd be another 2 inches deeper on this because all that fluid and inflammation would dissipate and your range of motion would increase even farther, then further negating your need for that anymore. And we give you a longer
I
leash.
have a tightness on my right side that's in my shoulder, comes all the way up onto the top of my skull, and then some left kind of hip pain that's on the inside.
When did you first notice that head and shoulder? When did you...
The head and shoulder's been off and on for a couple of years now. The hip has been maybe like the past year or so.
You think you might have scoliosis, or you have family history of scoliosis?
Family history of it. It falls in my dad's side. My grandma dealt with it more, so it's more like on the paternal.
But you have never been diagnosed with it, or nobody's taken the x-rays of you?
Whenever I was a teenager, they said that I had the starts of it.
Okay.
Or like I forget what the degree was, but it was like less than like 40%.
Okay. All right. And then the hip pain, can you point with one finger where's the most pain in the hip?
It literally falls right on the like inside.
On the front part?
Yeah, on the front part on the inside.
Do you feel that right now?
No, it'll come and go. But whenever it is there, it almost like it takes over the mobility of that leg.
The whole leg.
Yeah.
Yeah, we're dealing with some nerve issues. If it was just one spot, it might be, like if you, like for instance, if you're standing, go ahead and stand up for me. Like,
Yeah.
Did you ever feel like if you lifted your leg up, like if you bend your knee up,
Yeah.
does it hurt? Does that cause any pain or clicking in there?
Not all the time, but whenever that does flare up, it does.
You would feel in there? Okay.
Yeah.
Your left shoulder's a little high. Your head's sort of leaning away from your right side. Usually it's a way to get away from something that hurts. So it hurts and then your head just tries to avoid that. Yeah. Look at you. Feel your hips here.
Yeah.
All right, hips are pretty level. Just you got this right upper side. Look straight forward for me. The middle of your ear hole should be over the center of your shoulder. The more forward your head goes, this is usually tied with work and life and cars. The more forward our head goes, the more, even your jaw, I was reading, your jaw clicks.
Yeah.
How long's that been going on? Kind of long time too?
It's been really bad for the past 2 years, but it's started.
These are all tied together, right? So the head going forward puts stress on the joints in your neck. The joints in your neck will give you pain out to your shoulder. The head being forward can cause the jaw to jam. The head being forward causes tension in your neck, which affects the drain lines that affect your sinuses, your throat. All of that drains down the neck. The health of your lungs is tied with the more forward your head goes, the tighter your chest becomes.
Okay.
So the tighter your chest becomes, the harder it is to expand and release your rib cage. So breathing is harder. It's even, a simple orthopedic is just, pushing your head forward. Try to take a deep breath in for me. All right, now bring your head back. Now try to take a deep breath in. It's a lot easier to breathe. So when you turn your head to the left, the joints on the right actually start to separate. So when you bend forward, the joints separate. When you bend back, the joints compress. So when you turn your head left, the joints on the right are essentially being dilated and swelling up. And so that's part of what tells me that there's probably the knuckles in your neck a little agitated from the posture. So we're going to go in there and just clean that up. You said you've had some soft tissue work before. Have you?
Oh, yeah.
Okay, go. Deep stuff, man.
I've had cupping done. I've had gua sha done.
Okay.
I've done like the massage typically.
Okay.
So.
Well, we should be able to jump right in. If you might be heading to the beach after this.
Oh yeah.
If you can go get in the water, the salt water is a wonderful way to draw out the soreness that we're going to stir up today. So I'm glad you're heading there. Cross this arm under first and put this one. Sorry, there we go. This one under. Over. Bend both the knees for me. There we go. Take one Take one deep breath in, and then let your head go back. Let all the air out. Keep going all the way out. Deep breath in. Very good. Head back for me. Let all the air out. Let it all go. Very nice. Very nice. Deep breath in. One more. Exhale. A little tight there at the top. Okay. Arch your lower back. Good, good, good. Put your hands right on your belly. All right, perfect. Take a deep breath in. Look over this shoulder as best you can. Exhale. Yeah, a little tight here. Wow. Breathe. Exhale. All right, here we go. Other side for me, okay? Other side. All right, deep breath in. Exhale. Here we go. You've lost some range of motion there. Yeah. You gotta get that face up for me.
Yeah.
Here, figure this out here. 1 second. Everything's pushed out to the right here, like everything, like you were saying earlier. This is feels all puffy here on the right.
Mm-hmm.
Right side of your neck is all, my dad would call it blown out. It's all puffed up on the right. This is all compressed. Your head essentially favors tilting to the left. So the bones are all pushed out over to the right, and part of it is avoidance also. So it's a way to get away from the right. Your neck is just learned to just stay over on the left side. Now over time you'll eventually pinch the left side if it stays this way for another decade.
Mm-hmm.
You know, the alignment, you'll have what we call the compensatory pain. So you have the initial pain right now because you're young enough, the right side's inflamed. If you just keep avoiding it for a decade, now all of a sudden the left side will start hurting as a response to it doing extra work. And the last time you were adjusted was a few months ago, you said?
Yeah, I try to do like pretty regular maintenance.
Okay, I'm just gonna check and see. Here we go, here we go. Let it go right here. There we go, yeah, okay. I got your head, I got you, I won't drop it. There you go. Breathe. Yeah, we're gonna get it.
So you can see better.
These joints are a little rusty. We got work to do. I gotta get, I want, the bar is a lot higher than that for a 30-year, so Ed, why are you expecting so much from me? 30 years old, I expect perfection. You know, your back should move effortlessly. There's a lot of, what do you say, restriction in here, which is why your neck is hurting.
Mm-hmm.
If this moved beautifully in the upper neck, I'd be confused why your lower neck would be in distress. So 60% of the work of your neck is designed to happen right up here at the top, and if it's not moving properly, then another area has to compensate. Your neck isn't used to being curved, and that's part of the retraining of and long-term health of your neck is we have to get this position to be normal.
Okay.
And comfortable, and a place that your neck likes to be in, and this is what usually life takes us away from. And we call that the lordosis, the cervical curve. That is a knot right there. This is where you're going to want to get some salt, Epsom salt, or even the Gulf of Mexico right there. You're going to see a mark in a minute right there on that guy right.
Okay.
Yeah, you said car accidents in your history?
Oh yeah.
Oh yeah. Multiple? Is that
Yeah, a couple, just like rear endings, but like even that's enough trauma.
When was the last one that happened? Last car accident?
Years ago. 4 years ago.
Okay.
I just moved down here.
Plot thickens.
I had just moved down here and I got rear-ended pretty good.
And then the neck pain started soon after.
Oh yeah.
I might be the smartest doctor. Whiplash, then neck hurts. How did you figure it out, Ed? Mm-hmm.
Wow, how'd you
questions?
Right? How'd you put that together?
Jeez. You should have way more mobility than this at your age, and so I'm trying to figure out how did you lose it, and it usually doesn't just, easily walk away. Things have to happen to us that make us lose this.
Has anyone rubbed your neck like this before?
No.
Oh.
All right. A whole new world. You work at Disney?
Yeah, I do.
Okay.
Oh, you do? We were just at
For
Disney.
you and me.
Oh.
What area or what? I mean, it's a huge organization. So, like, where? What?
I work in the vacation club,
Okay.
so it's a lot of call center, like
Okay.
sitting at the desk.
There it is. Okay. I gotcha. So you're not working. I mean, I see the vacation club at the hotels. Do you work at the hotels sometimes, or pretty much all the call center?
No, just call center.
Okay. Gotcha. We were just staying at the Wilderness Lodge, and I saw some Disney Vacation Club people there, and
It's so nice there.
We love it. That's we honeymooned there when we got married, and
Aww.
it's our favorite.
Mm-hmm. Well, I don't know if this will help or not. I used to ride horses as a kid.
Oh, okay.
So I've been bucked off a few times.
My wife's the pro there.
We have 2 horses.
Oh.
I rode and I've been bucked off a lot.
You've got a friend. There's a little mark coming out right over here, right there. Just injuries that heal with tangles, so we have to comb the tissue to untangle it. Just a faster way to get it done. And
Okay.
eventually no marks come out. It'll be a little tender, a little sore up here. This is where the salt you want to get it on here later today. Usually, eventually you'll be able to just tell me where the marks will come out. The areas will get clean. The areas that aren't that dirty will get cleaned faster, and then all that's going to be left is this knot.
Okay.
The oldest injuries take the longest to dissolve.
Mm-hmm.
There we go. There it is. Let it go. There you go.
Wow.
I've been tight for a while.
Yeah.
I don't. It's like a bolt on a car. If it's been turned, recently, it'll turn again easily, right? But if it's been rusted or stuck for a while, it takes me longer to get everything moving. Now to let the side right there go. There it is a little bit. There we go. Good. All right. The whole left side is more raised up here. This is, maybe you'll feel it, is it like the ribs are all raised up or popped up here on the left. The side's a lot lower here on the right.
It's like the left side feels more tender.
Yeah, it causes a wobble, essentially, even all the way down into your lower back, which then, this is what I was saying earlier when I had you on your side, you've lost too much range of motion in what we call the sacroiliac joint, which is the joint I was checking in the glute. And so if the SI joint is too stiff, the lower back ends up moving too much, and that lower back is what controls the nerves that go down your leg. So also on that hug adjustment, if you remember earlier, I got movement here and movement here, but the upper back pretty much stuck its tongue at me and didn't like me very much. Part of what we're doing when I go through your spine and I'm checking the mobility, making sure all 24 vertebrae are moving evenly. And what I found was that, let's say half of them are working great, a quarter of them are working barely, and a quarter of them are just not working at all. And so, okay, I just have a high bar for 30-year-old. Sorry, we got to get that mobility restored.
Absolutely.
There we go. Okay. The more forward the head goes, the more the jaw gets jammed or clicks. So getting your head back, and that also affects the wisdom teeth and their drainage.
Okay.
Your spinal health is your health. Our world separates it and says, into different boxes, but I put it pretty simply that if your spine is not able to communicate freely what your brain is trying to tell your body, then things aren't going to work properly. Right up there, it's all crunchy. Yeah. Okay. All right.
Sorry.
I know you're fine. No, it's tough. I'm going right for it. That's the epicenter of where the ribs are all popped up right there. If I'm going too hard, let me know and I can dance around a little bit. But this is the sitting right here. It's all popped up. This is supposed to be in about an inch or two. This is the top part of your lumbar curvature. It's all become more kyphotic. It's popped. It's almost reversed right here.
Oh boy.
That's a spot.
Okay, buried treasure. Mm-hmm. Sorry. Okay. All right.
Not good for the rest of your team to lose members, and so we have to convince everybody to keep doing what they're supposed to be doing.
Oh, it's like going back to the horses. One of the first things you do whenever you get bucked off is you get right back
Get right
on.
back on, that's right.
Yes.
Mhm. Isn't that like partly though, like to convince them, tell the horse that they didn't win?
Yes.
Earlier, right here. Oh, I'm gonna hold you. I got you. Deep breath in
Okay.
for me. We're gonna stretch for a second. Here we go. It's okay. There you go. You all right? All
Mm-hmm.
right, breathe. Try to relax your shoulders. Exhale.
Oh.
Is that an elbow?
That was my shoulder.
Your shoulder? Oh, God. I felt it all the way in your elbow. All right, breathe. Go a little lower. See if I can get your upper back here. There we go, a little bit. Okay, all right, we'll go a little bit. Put your arms down for me.
Okay.
Breathe. Mm-hmm.
Oh, wow.
I'm sorry. There we go. All right. Mhm. This is the joint that's not moving properly right here. This is the sacroiliac joint. And then even this joint can give you pain right to the front. It'll feel like a rod going right to the front part of your hip. And it's really SI joint dysfunction, inflammation of this joint. If your side posture moved wonderfully, I'd be more confused. All that restriction you have is, well, that's why we have hip pain. And so we gotta get this moving here. There we go.
That's it. I'm getting a standing desk.
You know what? I can show you one thing better in a minute. I'll show you how to put some support behind your back while you're sitting.
Oh, perfect.
And that'll lessen the amount of debt that you accrue. But a standing desk is definitely a viable, helpful, benefit. Have that on the side also, just to give you a different position to work in.
Yeah. I work from home right now, so I actually thought about getting like a little treadmill. You can set up right there.
Just having a variety of positions. Just anytime you're stuck in one position, that's where people get really in trouble.
Okay. Oh, wow.
Right there.
Mm-hmm. Yeah, I feel that. Wow.
Yowza!
That's exactly.
How did I not know that was there? I know, right?
Holy smokes.
Breathe.
Sorry.
Right there.
Yep.
That's your hip pain right there. This is where it comes from. The sciatic nerve has to travel through here. And so when it journeys through this tissue, if this area is tight all the time, then it irritates the nerve right as it's traveling into your leg. And that's why you'll feel it. Like you said earlier, you said you were feeling it all the way. When you do feel it in your leg, how far down to your foot or your knee?
To my knee.
To your knee.
Mm-hmm.
It's at that level of area is what we call a dermatome, or you're dealing with nerves when you're dealing with an area that large. If it was your hip socket, it'd be a much more pinpoint area, and
Okay.
a certain movement would do it. Or you might feel it click, or you have usually a history of a trauma to that hip. Fell off a roof and my hip dislocated, or and so it's much more common to have nerve pressure. And I sit a lot, that puts a lot of pressure on my lower back, and then the nerves get easily irritated.
Mm-hmm.
Yeah, and okay. That'd be a spot right there.
Yeah.
You're fine, you're fine. Look on her face like, what are you doing, mister?
Oh my gosh, my feet are the worst part.
Oh,
Like,
that's funny.
I've had this done once and I laughed through the whole thing.
Not tickling, just trying to get some bones moving.
Oh my gosh.
Oh, there we go. Oh. Okay, okay.
She can't really stand it.
All right. Okay, all right.
Good go after going.
Ooh. Okay, okay. All right. There you go.
Wow.
All right, here we go. Okay. Okay, all right.
You should like scrape her feet. That would be funny.
I can feel the power in her leg right now. And
Knock me out. I do something in.
That'll get you some views.
patient knocks out. KO.
It's back here. Yeah, a little bit there. There we go. All right, put your hand on that hip for me. There we go. I got you. Press back a little bit with your elbow. There we go. Yeah. Have you tilt your head to the right a little bit for me? Well, no. Okay. All right. Sorry.
No, it's fine.
Here we go. Tilt your head to the right. Yeah, okay. Good. Okay. I'm just checking. See if we can get it. I got you. Go ahead and tilt your head left. There we go. A little bit.
Heard
A
that.
little bit. Tilt a little bit. Okay, it's good. All right. Go ahead and just open your jaw, and then close. Yeah, open again. Close. So it goes a little bit to the left. When she initiates open movement, her jaw pulls to the left, and then it goes back to center. So there's definitely a wobble in how the hinges of your jaw are working. Now we can work on your jaw and release some of that tension in there because the hinges are definitely pulling asymmetrically, but it won't ultimately go away until we get the curve back in your neck. So you can go in here and release the masseter. That's part of what's causing one side to bind up, and then as you open your jaw, it's releasing. But I want to say this is the side that's freed up. Yeah, this side's not bound up. When you open your jaw, the jaw immediately goes to the left. So we should find a knot here on the left side.
Okay.
Yeah, a little bit right here. There it is. See this knot right here? When you open your jaw goes, kind of goes left for about an inch, and then it goes back to center. But this right side's nice and smooth. You got nice whole side of your masseter here there's no contraction on the right, and then on your left side, there's definitely a blockage right here. And so this is, I almost look back as, probably when you were a kid, how your face grew, or even how you slept. There's so many variables that are what cause this, but in the simplest terms, the loss of curve in the neck is the overarching problem. And when the head is not positioned properly and there's no curve in your neck, you're going to have jaw issues, either TMJ or clicking, and then even sinus and adenoids that we talked about earlier. Those to me are all under the same umbrella. But yeah, right there, there's a... Can you feel that right there?
Mm-hmm.
Yeah, that's got to be released. And sometimes people favor to chew on one side. It's but right there. I was at breakfast the other day, and a gentleman had a giant hickey circular cupping mark on his cheek, and I was thinking some practitioner was very, I don't know, overzealous. This poor gentleman now has a giant circular bruise on his face that he's going to probably have to explain to everybody. I'm like, really? Did you have to do it that way? Maybe you could have just massaged it a little bit.
All the things.
Made it a little less obvious that a giant octopus attacked me. Your back or neck is one thing, but gee, on your face. It's really simple, yeah, right there. Posture is a distillation of the position that you're in for the most amount of time. So if we're in a seated position or rounded forward position, then when you go to stand up, you'll retain some of that.
Okay.
Because the ligaments that wrap your spine determine your posture. And when you're sitting, the ligaments on one side of your body are all tight, the other side they're all stretched out. So when you go to stand up, these tight ligaments just pull you back forward. So in order to change it, we have to counter stretch you, which means stretching the front side of your body, which you haven't done ever before. Nobody's ever arched your back. You have to be limbered up on the table to make the stretching effective. If your back is all stiff, you can't stretch that deeply. And so they kind of work together as a way to make your spine stretch more effectively. And then once you're able to stretch, your need to come in here is less, and you can kind of brush your own teeth and take care of it on your own. Yep, knees right, there you go. But you see what you've lost? You've lost range of motion. Your back, it wasn't needed, and so you incrementally we lose things. The joints, like I'm asking you to bend your finger and you're going, it's pretty good. Right? I'm going, it's supposed to do that. It's supposed to bend all the way, but you've lost. It's like, well, I can still live my life pretty well with just being able to bend my knuckles that much, but it's not a great way to, your functionality isn't there. And then what's actually happening then is other joints are having to make up for that loss of this joint doing what its job, and then other joints doing extra, and then you're going to sprain that joint. Get the idea?
Mm-hmm.
You have that from kind of the bottom of your shoulder blades to a little bit lower.
Okay.
That this whole section here, there's no wrong position necessarily. It's just the whole middle back area is where we're trying to target. You did great.
Thank you
Awesome.
so
So much.
much.
Thanks for dropping in. All right,
Yeah,
very
thank
good.
you.
Thank you.